Growing up in Bangladesh, I saw a lot of people in the family or in surrounding me in the neighborhood or neighbors, friends, family with a lot of medical issues. They were not being treated properly with the modern medicine. During my residency training, I developed more interest in specialty headache medicine, because during residency I noticed a pattern where a lot of my patients had migraine and headaches, and a lot of those patients were women in their most productive years in life, and that really impacted their quality of life, their career, their personal life. My first encounters with patients are very thorough. They can be long, but they're very pertinent because I get to know the patient for them, who they are. It's not just a headache, because the headaches are symptoms, not a diagnosis. So I try to get to the bottom of what's causing their headaches, what's triggering them, what other medical issues or personal issues or stressors in their life. It could be many different things, and trying to get to know all those aspects and for my patients to trust me with those information. So usually the first encounters are just really getting to know the patient and then coming up with a good plan moving forward. They become a partner in their own care. So, and from that point on, it's usually a shared decision between us, and circumstances change as we move forward. And every individual is different, and every time they come in, there might be something changing. So it's always an evolving treatment plan. When I see them coming in with a very poor baseline, and after a couple of sessions, or even during the first session, when they start understanding why they have something, that validation is, I think, even more important than a prescription. So that gives them hope, and that gives them the opportunity to look into things more. And the hope is, of course, very important in progression of their care. They start seeing, improvement, better quality of life, and they, sometimes they message me on the portal saying that, I thank you for giving me hope, or thank you for treating me or listening to me. I feel heard, and all those things are very, very rewarding for me personally and also professionally. I feel that I have achieved and made a difference in someone's life that day.